Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should probably be aware of before using Trazodone. Number 1, when you start using Trazodone, you may experience daytime fatigue or somnolence. Somnolence is a state of drowsiness or a strong desire to fall asleep. In terms of percentages, 6 to 15% of patients may experience fatigue, and 24 to 46% may experience somnolence. Because of this strong desire to fall asleep, it's important when starting Trazodone, just for the first couple days, to be cautious when doing things like driving an automobile or operating heavy machinery. If possible, it may be a good idea to try to avoid these activities, again, just for the first couple days, until you have a good idea of how the medication makes you feel. For some patients, these effects may go away after some time when the body gets used to the medication, but for other patients, they may struggle with it long term. If the fatigue or somnolence begins to affect your activities of daily living, it's worth having a conversation with your prescriber during a follow-up appointment. Your prescriber may choose to decrease the dose of Trazodone or try a whole different medication to see if you can avoid these side effects. If you're using Trazodone for depression, it may be a good idea to try taking your dose later in the evening as a way to try to avoid these side effects as well. But of course, if you're using this medication for the off-label indication of treating insomnia, you would already be taking the medication in the evening. Number 2, there is a black box warning associated with Trazodone. This warning is really meant for all antidepressants, including Trazodone. Antidepressants have increased the risk of suicidal thoughts and behaviors in children, adolescents, and young adults being treated for major depressive disorder or other psychiatric disorders. Short-term studies did not show an increase in suicidal behavior in adults greater than the age of 24. And there was a reduction in risk of this behavior using antidepressants compared to placebo in adults older than 65. So risks associated with Trazodone in children, adolescents, and young adults must be balanced with the clinical need of the medication. So while patients are using Trazodone or other antidepressants, we want to closely monitor for changes in behavior, suicidality, or mood changes. As a patient using Trazodone, journaling can be very helpful to track changes in mood, and this gives you the ability to show up at a follow-up appointment with your prescriber with concrete information to give to them to help them make a better informed decision of how to move your care plan forward. It should also be noted here that this medication, Trazodone, is not indicated to be used in pediatric patients. And number 3, while using Trazodone, you could experience gastrointestinal side effects. There are several GI side effects that could occur with the use of Trazodone. Looking at percentages, we have constipation occurring 7 to 8% of the time. Diarrhea can occur in up to 9% of patients. Vomiting is more rare than the other side effects mentioned. This comes in at 1%. The most common GI side effect is xerostomia, also known as dry mouth. This occurs at a rate of 14 to 34%. And nausea is common as well, happening about 21% of the time. As always, if these side effects become a concern for you or begin to affect your activities of daily living, be sure to have a conversation with your prescriber during a follow-up appointment to see how you can move your care plan forward. And that's all we're going to talk about today with Trazodone, but before you take off, I wanted to quickly let you know that you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.